pressure injuries with the checklist that goes financial disclosures to share with you. Cathy, Heidi, and I all started our careers as neurological PTs working in the spinal cord injury and our passion to serve our clients. We've continued to work together across multiple states over the last 10 to 15 years in some way, shape, or form as a part of the clinician task force. And if you've not heard of us, please come by our booth in the exhibit hall. We would love to meet you. What I would say is if you're not around here every single day, they help keep me excited. When we're here at ISS, this is our big tribe, but finding a small one to keep you happy. These ladies do this for me every day. Couple things that we want to do today is looking at some of the causes of pressure. We're going to provide you a checklist that we've kind of been working on to collaborate to provide a resource for you, not only for looking at clients and patients. So these are our 3 objectives. We'll come back to these at the end. We really hope that you can walk away today with some tools and some things that you go back. So we've all been here, right? We have that person who comes to us, or hey, I talked to my doctor and they say I need an air cushion. Maybe they tell you, I have a red spot that goes away. Most favorite is when I walk out to the waiting room and there's a person on a stretcher and their cushion is on their lap. And I'm like, hey, awesome. This is a great appointment, right? And one thing that this does tell an injury that they've had, and I'm just now finding out about it as our seating and mobility specialist. We really want to add the team much earlier in the process. We don't want to be an afterthought. We don't want their chair and their cushion to be an afterthought because we're really going to talk about a comprehensive approach with you today. When we talk about pressure injury, we know this is localized damage to the skin and underlying soft tissue, most commonly over a bony prominence. We know that this is more painful for that client. We know that oftentimes this is going to be caused by intense pressure, things that are going to contribute to that, such as moisture, thinking about our microclimate, looking at nutrition, perfusion, comorbidities, and condition of the soft tissue as well. They're happening all the time. Here in the US, we see 2.5 million people develop one every year. That is such a huge number. Implications and economic implications. We tried to pull some data. Now, it's hard to compare across the world. We have different healthcare systems, different currencies. But really love the data out of Canada looks at it at a per month cost for the end user. $2,400 for store. And if you have an infection, now we're looking at almost $13,000 a month. That is astronomical, thinking about how much that. This is a part of why we want to be on that team. There was a small study, they looked at persons with spinal cord injury, who had a pressure injury, that were going to undergo a surgical intervention, so most likely a flap surgery. And they looked with a seating mobility expert. And they saw a reduction in the recurrence of their pressure injury down to 1. If that doesn't tell you we should be a part of the conversation, I don't know what does. A 50% drop in recurrence is really low. The whole team needs to be we want to be a part of it. Too often we're not concentrating across the globe. Maybe it's that they don't have a seating expert close to them. Adults in the entire state. That's really common for us here in the US. So just thinking about not only are we not called, but is there someone that they can't complete today with clinicians and suppliers? And in a moment, I'm going to ask how many are in the room so we can get an idea. But really thinking about we're looking at that end user in terms of what are their mobility needs, where do they want to be, where do they live, work, and play, and really looking at our ATPs and supplier. These are our experts on our products, material technology, looking at the fit and the performance of those materials for that end user and together. I really like this graphic. I've made it over and over in presentations that patient and client at the center. They are the expert in their own life, in their health history, in their needs, what they want to do, and what they need their seating system to do for them. Practitioner, the wound care team, we want to be a part of their team, and they have to be a part of ours. I mean, they have to sign off on our documentation, right, and get things approved. Cool. And looking at a way that we can be comprehensive, patient and client-centered, something that's already happening. We know that lifelong health and wellness around skin health is extremely important and something we educate all of our clients on. We want this to our clinicians. We wanted to be able to partner with our suppliers and be able to say, we think we could cut this down. There are some questions here that would be really useful for you, conversations with your users. Full disclosure, this is not perfect, it's not all inclusive, and is not a validated tool. It's just back to an article, the Seating and Wheeled Mobility Clinicians Contribute to the Wound Care Team by Fitzgerald, Mullison, Carver in 2027. When you look in the literature, you don't see seating and wheeled mobility experts combined with wound care in the literature very often, and we wanted to change that. Clinical practice guidelines and making sure that we were going to be as evidence-based as possible. There is a new guideline coming out this year to keep and experiences of not only ourselves, but other clinicians that we knew and suppliers that we had partnered with. When we started coming up with that checklist, they start to put it into categories and make it usable. And we landed on the ICF. The reason for that, so the ICF was approved in 2001 by the World Health Assembly, and really this is a way for us to create not only connections of all of these facets of health. So when we're looking at the health condition, we may be looking at their maybe not. We're also considering some of their past medical history. When we get to body function and structure, now we're starting to think about those things that are measurable. Activities, now we're starting to see them move. How do they transfer? Are they in the legs? Someone else help with that. When we get to participation, now we're really centralizing on that center. Where do they work, live, and play? Do they go to school? Do they need to go to work? When we get to the bottom, and this doesn't make it the lead environmental factors, where in the country do they live? What type of community is it? What type of equipment do they have? When we get to, do they have a family? Do they need to go to work? Where are they in their lifespan? So really starting to put these things together. Comprehensive checklist for you in a Google Doc that you can have. This is yours to utilize. There are a few other things within there. So for instance, in our contact information, so if you walk away with one thing today, this is it. This is what we want you to have and use and integrate. So with that, I am going to turn it over to my co-presenter.
Okay. So we could do is just touch upon some highlights of it. We're also going to look at how it applies to a client. And then Cathy and I will talk about a client of hers that she saw and how she could utilize this checklist to really dig deep and figure out what was going on for him. Beyond just pressure mapping or beyond just ordering the cushion. Instead, looking at the person, their tasks, their environment, both day and night. Case that we want you to think about as we go through the checklist is we're going to call him John. He's clinician first contact later in the presentation. So let's introduce you to John. He's a 64-year-old male, sustained a C pull-up bar. He is a full-time power wheelchair user since his injury, and he was a pilot at the time of injury. Through a recurring red spot on his right IT. There was no supplier present at this appointment. So as Kate, and the first part we're going to talk about is health condition, body function, and structure. So again, I'm going to just, it goes into a lot more detail. When we have somebody come with a pressure injury, we want to think about where is that injury located? Do you have any idea why it started? Sometimes you'll have clients that know exactly, they can pinpoint what happened. You want to find out, is it an area that actually makes contact, with the cushion, not an area that you can even pressure map? Do you need to look at other equipment, their bed? Do they use any? We want to dig into their past medical history, things that we don't often think about, things that we know can affect healing. Are they a smoker? All of that's going to affect and impair healing. Another category we have hydration. So from a nutrition standpoint, are they eating a well-balanced meal? We know that the increased intake of protein is important. Nutrition is to our dietitian. While a lot of these things we don't affect directly, we are part of helping them be educated to maybe make referrals. And so we still need to ask these questions because they may not know that's important. We know that extrinsic factors that can contribute to skin breakdown are things like pressure, shearing, and microclimate. So are they, right? You have extra layers. Do they have extra padding underneath them? Do they sweat a lot? So maybe that's because that can contribute to skin breakdown as well. And finally, the one that I want to touch upon is considering that aging is thinner and is less elastic. and that makes them more susceptible to skin breakdown. So if you have that client that you've known and you've been working with for think about, could that be contributing? And maybe that cushion, even if it pressure maps well, here, as we're going to talk to Cathy about John, specifically in this category of that health condition. Can you tell us about, hey, can you tell us about John's pressure injury?
So I have worked with John for a number of years. We get to see them come for the new chair, for those modifications, or the next chair. It's so wonderful to work somewhere. We make you have some assumptions that maybe you might miss something. So I've had an opportunity to know him for a long time. Stays pretty healthy. Is in a pretty well fitted Group 3 power wheelchair with all the power functions. Major surgeries or issues before, nothing really anticipated, but just this recurring red spot. I've seen him before for it. We kind of he presents again. Here it comes back. I'm really concerned about it. I want to map again. So that's how he ended up, wanting to come out.
Did you reassess his range of motion, his tone, his posture? Did you have any concerns with that?
I haven't seen him before. I did not observe a lot of change. There was no change in stiffness, how his spasticity was feeling. We did run through a lot of things like any changes in bowel and bladder, UTIs or a big perturbate catheter, on a good bowel program. So we kind of run through a lot of any updates on your pain, changes in, did try to screen through a lot of the medical systems.
Good. And so you talked about the past medical history.
No, he's same way. He's very conscientious of his diet. He stays on a pretty good schedule. I never see him without. He's always trying to stay on top of that.
Perfect. So this kind of gives you an idea of what Cathy. So he had a C-spot on his right eye teeth. She did say he had spasms, some suprapubic calluses, and things like that. Bowel program, no concerns, but does have chronic neck and shoulder pain. Condition, body function, structure. There was not a whole lot that she was concerned with at this point in this area, correct?
Right.
Okay. So portion. Again, highlighting parts of activity and participation. We're going to assess the lift. Do they use a transfer board? Do they use no equipment? If it's a Hoyer lift transfer, do they have the Hoyer slings, the thicker seams, or it can get bunched underneath them? And so that's going to lead to increased areas of peak pressure. If they're gearing, or are they getting enough lift to clear? Maybe they're rubbing on that tire or that wheel. So we're going to really take a look at that. It's not enough to just ask them, are you doing it? And how are you doing it? But to really watch. Someone's leaning, they say, well, I lean to the side. In theory, that would be great. But if you see them lean and nothing changes, then it is effective. I'm going to go back to transfers for a second and talk about the surfaces that they're figure out. How many of you have had a situation where someone comes in to see you and they're in a chair and you start looking at the chair and you're trying to talking, you find out that that's the chair they use only when they go out in the community. So that's not the chair that you really should be assessing. Is we really want to look at what other surfaces are they transferring to? A couch or a commode chair. So we start really digging into those transfers. Are they able to do so? Their environment, what they're doing. Are they working? Are they in school? Are there extracurricular activities they're involved in? So we've had a couple of talks here where we talked about, we're not involved a lot in it they're using, then you can help problem solve with that as well and see if that might be contributing to it. And then pain. You'll see first category and this one. And we think about it this way. In the first category, when I think about pain, I'm thinking about how it might affect their shift away from that. So it's more of how that's affecting posture. When we go into activities, so you might have had somebody who was doing transfers really well. They were getting that clearance. And now their shoulder hurt. And now for 20 some years, and you knew that they were doing fine. Again, reassessing that's going to be crucial because now you might have had it. So let's go back to John. So John's activity and participation.
He transfers by Hoyer lift. And when he comes, he has the sling underneath him. But like I said, very conscientious. So take away, he wraps it around his armrest so that he's not sitting on those seams. And when he transfers, once he's not really transferring any other surface and does not use any other means to transfer to any other surface. So he's strictly for your lift with a sling. Stays contacted with his back, and then the legs he undoes and kind of gets them away from his hips.
Okay. And how about is he able to check his skin or someone else checks it?
So his wife checks his skin when they do showers or bed baths. What was your other question again? I went straight.
Checks.
Yeah, so weight shifts and pressure relief. So he does have a great power. However, all right, how many people really do them frequent enough? Well, let's be honest, because it's not functional, right? So you need to tilt, you need to recline, you need to do it every 30 minutes. Okay, it's not functional, so we've got to find some other ways. But he moves along as frequent as he can, because he cannot just drive down the hall and tilt and recline. He cannot go to all the ball games. He cannot do it while he's rocking and he's leaning. And through the entire visit, he's just rocking. Which my mind started going in. I'm thinking that this air cell cushion, the bike care cushion has all the little pockets in it. He uses a combination of weight shifts, and then, like I said, he has family that helps him keep an eye.
Participate in any extracurricular activities? Does he change out of his current chair or transfer out of that chair? Were there any concerns with him?
He drives a really cool truck. The door goes out to the side. He pulls up in it. It picks him up, slaps him back in. I call it the robo truck. We're in college, and a son in high school, so he's active with their activities. His son does sports, and he goes to everything. He's not working in their local church, and so you see them. I've seen them in Home Depot, so which is where a lot of people have to go. So not a whole lot stops him.
And Cathy said he uses that Hoyer lift. He does have the sling in there. He's active in community. He does uses power seating for pressure relief. Try possible shearing.
I am, because he's, aging, atrophy, obliquity that we've always kept an eye on. We've always tried to build up that side or offload that side. All through that, I thought, I'm wondering if we're going to need to just try to look at other options to help with the shearing aspect.
Okay. So the final, and I think this is an area where as clinicians and suppliers, part of it we do really, really well. And I think part of it maybe is for me personally. So we want to look at their current equipment. And I think that is what, the age of it, is it breaking down? How many of you, and they come back in saying they have this new spot and their knees are up really, really high, and now they have money. So they've been messing with the chair a little bit, probably to fix some other issues. So that's a good point for not comfortable, like we can modify that. But also now we're having, instead of getting that good pressure distribution, we're getting a lot of peak pressure. Now look at the cushion, right? So I'm sure, again, we've had these situations where we get the cushion to assess, is the cushion breaking down? How does it look? And it's in the chair backwards. And so are we educating early on? Do we educate them when they get that equipment delivered? Are we following up on that? And so we also want to look at their 24-hour positioning. What are they using? Do they keep the head of the bed elevated? Are they potentially shearing from that? As far as vehicle, if they're driving, so if they're driving long distances and they're transferring out of that onto a normal, typical car seat, do they need something out of graphic area? I think this is one I don't think a lot about until I lived in Alabama. It's hot and humid there, very sweaty. So we think about that from a microclimate standpoint. If you're in an area with elevation, change the effectiveness of a cushion. The air and gel, they're going to be changing based on that as well. And then finally, we do some help. So do they have access to healthcare services? And how do you educate them to meet them where they are? That's a huge part of our job. However, it can be incredibly overwhelming. So we want to make sure that we are providing them with good information with them when they leave that appointment. So Cathy, we're going to talk about environmental and personal chair setup in the cushion. Talk us through any concerns with that, how old it was, did it fit well, did you have any concerns?
was current power. I did go ahead and pressure map him. I like to put the pressure map under someone early in the appointment just to watch it. It also can help me see are we getting good distribution through the femurs? You know, I can check the foot height. So we kind of had that going, which kind of helped me check fit at the same time. The supplier would have been there that day, had access to our supplier by phone if we needed to that day, but fit was really okay.
Perfect. Important factor. So clothing can get bunched underneath them or extra layers, things like that. If they're wearing jeans, it can have those grommets. The clothing and the layering. Did you have any concerns with him for that?
Yeah, he's really good about wearing thin clothing, 99 cents into a stitch remover, so that you have those people that wear blue jeans in the pockets where that point different how they can get one and take it off because nobody's looking at the pockets, right? They're sitting. So invest in that for your client.
Perfect. And what about
For over 20 years, had 2 children that he's active in raising. When he was injured, they were really young. So they were raised with their daddy being in a power wheelchair. They live in an accessible home, no kitchen access, and back to other equipment. It had just gotten easier as they had power chair or pressure areas from that. He slept in a hospital bed with an air mattress. Dr. Brianda encouraged us to be watching for some terminology changes there. So all that was good. And like I said, I've had a relationship with him. My mind is still that maybe that recurring sore is just shearing and aging and atrophy, and maybe we're going to start. And I had known that his wife had often had a history of alcoholism and that had impacted his family doing, and he opened up a little bit. I think again, because we had a good relationship and parents were aging, trying to get one at a nursing home while the other's in the hospital. One's the ICU, near dead back, to struggling with alcoholism. And I was like, oh wow, that's really, really difficult. He's really gotten bad. And I was like, well, can you tell me more? Are you okay? Do you feel safe? And I was like, are you sure? And he just began to kind of open up a little bit more as to how verbal wear, and it just, I may cry thinking about it. But that she had you're there for a while. And I'm not here to throw any stones at people who struggle with alcoholism, but him and his health and their family and their home. And it made me take a big step back to now I don't think we have a shearing problem. We have a moisture problem and we have a time problem of being in that environment. But our people, so it was an eye-opening day in the clinic.
So again, this is just kind of a review of what went on. And so I want you to keep in mind, Cathy got a referral for pressure mapping. So in the pressure mapping, he pressure mapped well. He looked okay. Everything was fine. From a health to no concerns. From an activity and participation standpoint, again, there wasn't really too much concern. And this is one of the reasons that we felt we look at an all-encompassing picture of this person, right? So that we can really dig deep. I'm going to let you address, you already talked about a little become a concern. And then what did you end up doing?
If you are not safe, please encourage you to call 911. Okay, please do not put your children aware, and they're aware. His son's very supportive and helpful at home. Understood and mom was going through these highs and end checks, helped with the transfers, helped to make. So he really stepped up, and that was very helpful. It was also eye-opening because he was going through the divorce process, but he was real fearful of losing his accessible home. He had spent his whole time way in and out of how would that impact him of having an accessible home and vehicle. So there was a lot of potential impact on this. And he did still care. So we ended up trying to connect him with our social worker, understanding what resources were available to him, potential respite care for him, stay herself, and just making sure he had access to those resources while he tried to figure out.
how we utilize this checklist for a client. What we're gonna do from here, I will turn it over to Cathy in just a minute. We're gonna meet you, and if you can go, you can scan this QR code. We really want some audience participation and practice in using this checklist. So you got your Mentimeter, and you can put in any questions that you have, and we'll monitor that. For those of you like Cathy, set up here where you can ask the questions as well. So I'm going to turn it over to Cathy now.
Okay, so you're gonna get a chance. I'm gonna introduce you to the patient. And plus I would love to hear, we didn't do this. How many clinicians, in the room? All right, and please know that what we put together here was for all of us to use, because we don't know who's gonna get that one of us or the other. So here's the situation. The other one before, the guy came into the clinic. So this is Tom. He's a young man, 30 years old. He has a P10 spinal cord injury, which again, the other guy was a fire in Alabama. It can be autonomic dysreflexia or other, medical responses that cause moisture. So this gentleman, he was injured at the age of 16. He's 5'10", 165 pounds. He is very active and very athletic. He works, he travels, he goes everywhere. And he now though noticed a red spot on the old. I'm just going to swing by my supplier's office and get him to order me another one. Or he's going to call you either way to try to get one ordered. And you know him well. You served him for a number of years. So there's your scenario. Pull up your checklist. What questions you might like to ask, because I'm going to bet. Found yourself in this situation, suppliers? Let's be honest. I mean, hit me another question, I got a rest on. Okay. You got a minute. Oh, no, we have some action on that QR code thing. All right. All right, does anybody want to start us questions about Tom? Am I the only extrovert? I know some of you. Okay. Where is the red spot? Sacrum. About 2 months. Going, taking kids to daycare, and he travels frequently for work, so he doesn't want anything to stop him. So we're getting close. You'll learn in a minute. We're getting close to the end of the 5-year mark of this chair, so it's almost 5 years old, and it's really compressed. We'll not open that can. How about that? It's another talk. What was your last question? No. Same cushion. So the question is, what's the kind of cushion is compressed? So it's a gel-based cushion? Yes. Okay. Question is, has he had any health issues? Or then if I have anything to say, he's probably gained a little bit. He's having this kid thing causes you to gain some weight, parents. I'm going to get an amen. Yes. 24-hour lifestyle our people live. And I will tell you, that's what separates us, I'm going to be honest, is we get a chance to look at the entire life whole year than some of our other clinician friends who kind of steep up to about an hour at a time, 2 times a week. Does he carry his chick 3 years old? Yes. Oh, great question. Has he had any other surface to sit on? New furniture, new car, new out? So he does some weightlifting. He'll transfer out for that. He uses the shower bench. He transfers from his vehicle seat, loads the chair, so he sits on the vehicle seat. Lots of different surfaces. So yes, he does not use any no overlays. Yes. She wants the clicker. Yes. Nothing new, just a regular program. Topic of the health, give me my slide. Yeah. Condition, body, and function, and absent sensation below T10, his level of injury, he does not feel that. His range of motion and tone is pretty good about checking his skin when you can slow him down long enough. He knows what his body needs for his bowel program to stay on track. Very good about hydration. Very strong. Are y'all loving the checklist? Okay, very good. All right. So our next look at those various things under activity and participation. We've kind of talked a little bit about his lifestyle. Okay. Yes, there's the other surfaces. And he does the traditional pop over transfer. And I was very, he also, so that was like heart palpitations while you watch him transfer over that. But he does during his transfers, does not use a board or anything like that. He's a little rough landing every so often. But, all right, help me out. Questions under activity and participation. Say that part again. Where's our microphone? I may need some help. Oh, how does he sit in this chair? Not very still. When she's going to move around this microphone, so if y'all want to raise your hand or whatever. So, how does he sit in his chair? Does a pretty good job with his weight shifts and stuff. And sleeping, you asked, he sleeps in a regular bed. Not a huge concern from the bed.
Is he doing adequate functional pressure reliefs, compliance-wise?
Probably every 15 minutes that we think people should be doing. I think he does a lot and then sits for a while. All day long do is they may be real active, shifting, and then they have to sit in a meeting for an hour, that kind of thing. So pretty good about weight shifts, very.
You mentioned he travels quite a bit for work. How does he travel? Personal vehicle, aircraft, and what support services does he use when he's traveling?
He probably in quite some distances at times. You guys are familiar with the Rojo adapter pad. He takes that with him and sits on the airload. That's one thing he uses just between him and the airline seat. Anything much thicker, he's a real tall guy. Sits him up too high.
Okay, I'm going to interrupt for a second.
Yes.
I am going to go backwards. Some people asked for the QR code for the checklist, so I am going to go back. So that active as of late.
I did not ask that personally. I assumed all as well since we now have 2 children. But I did not ask. Yes. Stylish because he is very active and all that kind of stuff. He wears very soft tight pants and is really conscientious though because he knows one setback like this changes his lifestyle did to contact the supplier to get ahead of this.
Has his Rojo adapter pets like out of town driving?
Not a lot because they're very young. The Rojo adapter pad, when I'm traveling, he's on a gel-based cushion every day in his chair. So I think the Rojo adapter.
Go on to environmental and personal factors. There have been some questions on that, but from an environmental and personal factor standpoint.
So go to your checklist, inclusive list, and what we'd love to hear from you in our discussion here in a little bit is, are there things that are missing from this? And these are really meant to kind of trigger your thought processes when needed, as you see them develop. Maybe I need to ask a little more. Okay, she asked if there's anything else in this current seating system causing this sacral area. Is that your question? Anywhere else he could be having pain that might impact his movement in the chair as well. He has just a device on the back of his chair as needed to kind of help with some of that. I would say it was a huge contributing factor.
Goal?
Mainly wear the athletic shoes that are pretty consistent on the over here. The posterior pelvic tilt, has that changed from how it used to sit? Not really, pretty flexible. Posterior pelvic age probably does need to be replaced. So we'll get to what we did.
Some great questions here on the men's reader. We're going to take that and look at these and help improve our checklist as well. So I appreciate you adding to it.
Here, hey, I just need a new cushion. I need to keep moving. And he really didn't even realize that he kind of had to repair need further. Was like, do you know you're eligible for a whole new chair and a whole new back and a whole new cushion? how about we head on back to the clinic and hire for digging a little deeper, and saying, you know what, let's go look at the whole thing here. And so we made an appointment, and then what we came to for his pressure area of concern was just that everything had now compressed with sizing of things that he do, and the compression of the backrest also contributed to the posterior pelvic tilt. So we begin to offload that area a little bit more with just updating everything. So great opportunity for the team approach too. Yeah. Take a look at him. Cushion looks good. Okay. Hey, must be nothing else. Good luck. Let me if you need any new cushion and let him continue on. Because you could have done that. That we do that, but we do have an opportunity to offer more. So us think a little bit further and make sure that we're being comprehensive in helping people. That one basic thing. There's some long-term problems that can happen. Some of you may have experienced, and now someone has a sore that has really gotten out of control, and now they're going for flap surgery. If we had this type of thought process can help us avoid some. And it allows us all to use our gifts, our talents, our strengths, what we bring to them. Just use this as a chance for us to think past what's coming directly to you. All right.
So we just want to come back to the idea of social determinants of health one last time, because I think it's a really important place for us to focus. We want to be thinking about someone's going to think about what access to healthcare they had. When we think about health literacy, sometimes we'll ask patients for a teach back. Let them tell us in their own words what we just asked them of time. If we give them the opportunity to teach it back to us, one, we get to understand, did you comprehend? Did you truly understand all of the nuance? Sometimes it gets us out of our clinical speak. So this is a great way for us to think about what is their health literacy. The other thing I would really encourage is don't make assumptions about what the person before you did. Now, we're always going to manage up, but I can't guarantee where I work really took the time to talk about eligibility for replacement, how to take care of materials, how to keep over, this is how you do that pressure relief, and let's go ahead and practice it. I have to assume that maybe they don't know that. I wasn't the person, or that they really get that up-to-date information that they might need. In many areas of the country, somebody doesn't have access to that. Where I work writing on the back end, I'm unteaching and then reteaching all the time. When we think about the idea, when we do our time, right, and it's overwhelming. When they get home, they're thinking, man, what was that one thing that Cathy said to me that I need to remember? When they have a physical handout when they get home, we are talking so much, right? So giving them that physical handout really helps in making sure that's at a 6th grade level education in the writing of that. Resources for you, these are all linked on that QR code. The first 4 are literally handouts you can print that are extremely well. The last 3 are more supplier and clinician focused for up-to-date education, your knowledge base, how to push that to the next limit. So we just wanted to provide that for you. We're going to come back to hitting that nail on the head about the interdisciplinary team. We're considering all of our stakeholders and the expertise that each of us brings to the table. It also allows us to consider what are the other referral, nutritional advice, do they need transfer retraining. We know that when somebody comes in with an issue, it's an opportunity for us to get them to another expert and another member of our team. Just a tool. It's really great for biofeedback. It's great for reinforcement of education, but it's not always going to be the solution. So when we need to go get pressure map, let's just check this. We want to make sure that we're stepping back, as Cathy has indicated, to really do that thorough assessment today. So oftentimes, people come in and, well, if I have a pressure injury, it has to be my cushion. And I would challenge that most oftentimes it's not actually the cushion at all. So we're really focused on timing today to give you that chance to ask us, are there things that you don't see on that checklist that you want today? We want to be thinking about what's that one experience, that one person that you've interacted with that changes now how other things that people sit on in their everyday. I had one person make this one mistake. I had seen him 4 times to try and figure out that hundreds of layers and pulled other family members in to ask what else he was on. Did I ever find that cause? And it is one of the first questions that I ask ever. Questions do you have for us?
Now, this checklist is really good. I love it. Where I have found that more that are looking at these patients, because I work in an area where health conditions are generally pretty bad, and there's just huge wound care. Don't understand anything about how the roho works or doesn't work, or the rest of the system and you're somebody. And so it's such a long continuing education process with the doctors. And I think some of these points on the checklist just to give me some good ideas to go back and continue that education.
Fight for your place in the wound care team. Take the article that we wrote, and take it with, in a wound care journal. So use that, to validate your place in the team.
Are you in your documentation? And what about collaboration with thinking about wound care doctors as far as
The short answer is no. I do not take any photos of wounds, and we have a great relationship with our wound care team. We get to sit too, so when they're able, they finish the sitting protocol enough just to make sure that what they're sitting on is great. They just want to make sure they're on something well and reevaluate everything after they're able to.
What I will say though is I ask my patient or client to have a phone. And then that way, if I do a phone follow up, I can say, okay, get those pictures out and compare what are they looking like so that they are tracking over time. But really simply.
Thank you, folks. What a really, really great presentation. You made a comment that mental factors and personal factors, you write it down at the bottom. You actually think they're the most important. I completely agree with you. And actually,
Wow.
so if we really want participation, what we have to understand is the environment, which is social determinants. And if you start thinking there and you move your way down, is that condition? And we go to the body structure, then it's like you almost run out of time before you get to what we actually know on our bones.
That's an excellent point. Thank
I
you.
just wanted to say the same thing to kind of piggyback on Jean's everything. You made the in the bottom of your presentation with the gentleman, John, where there was a big change with his caregiver. So he calls me up and he's like, I have this, outer trochanter, this wound that was there, he's never had pressure, long-term pouches. His wife is crazy diligent about looking at his skin and checking him. And then, so when he first question was, hey, where's your wife at? And she's like, she just fell, she broke her hip, she had to shift his bowel and bladder. And then he was trying to manage kind of on his own. And so he on his own took an incontinent liner and put it over his roho, which has no stretch. So that really nice outer stretch, or so what was happening was it wasn't immersing into the cushion and he's getting pressure on the outer hip. And then also his hip got all that outer pressure. So immediately, I realized that it was really that, his wife's not helping him. He's trying to do what he can. Design, you don't even have to have a cover on it, we can rinse those things out, just looking at that. And it wasn't the cushion as much as it was the cover. And that changed from that caregiver support.
Caregiver changes. It's amazing how when a pressure sore happens when there's a death in the family, or something like that.
And
one more.
just a quick comment, and I know I'm speaking to the choir here, but are making changes to somebody's seating system to make sure they're not causing a new pressure area and problem. I can't tell you how many cases cushion to correct an obliquity that wasn't correctable and ended up with a.
That's a good point. Thank you, Barb.
I just wanted to share, partnering with the pelvic floor, they're just not well educated in where the wound is, and sometimes it's a prolapse or something like that. I don't know, I just see myself taking a lot more pelvic floor classes to understand sometimes where these wounds are coming from, so just something else.